Hey everyone, it's Melinda here. I am making this video to answer quite a few questions that I got from a few people underneath my recent video that I finally got a diagnosis. And I also wanted to prove that I do have a pulmonary embolism, because apparently there are some people out there that think I am lying about my pulmonary embolism, which is completely ridiculous, and I find it funny that people think I would actually take time out of my busy life to lie about something like this. So I am going to show you the paperwork proving that I do have it, and you can kiss my butt. There are some things that I have marked out on here because you guys don't need to know my social security number or my insurance information or my birthday or my address. So the first paper I'm going to show you is from the ER, which is discharge papers. Patient's name, Melinda Martin. That is me. Date and time. What for? Pulmonary embolism. There you go. The next one is the radiology consultation preliminary of my CAT scan findings. It says history, CAT scan of the chest, findings of pulmonary embolism on the right upper lobe. So there you go. Not lying. Anyway, the first person that asked me a few questions is Melissa Hall. Hi, Melissa. I'm going to answer your questions. The first one is, why didn't they admit me? I really can't answer that for you because I have no idea why they didn't admit me. I asked myself the same question. I know they didn't admit my aunt 2 years ago, and then she ended up dying the next day. So I've been really stressed out. I think they should have admitted me. My doctor talked about admitting me after the fact Tuesday when I had my my appointment with her Tuesday, only because my breathing hasn't really gotten any better. Well, it wasn't any better then. It's starting to show signs of getting better now, as long as I stop myself from having anxiety and panic, which is hard. I've been doing meditation and everything, trying to prevent shortness of breath with that. So I really can't, I can distinguish the two from each other, but it's a lot worse when I do have anxiety and panic attacks along with it. But I'm sorry I can't answer that question for you. I don't know why they didn't admit me. Maybe because they thought my condition was stable and it wasn't severe enough to admit me. I don't know. You said you're wondering why I said I would have to take it for the rest of my life and what my clotting factor is. I never said that I would have to take it for the rest of my life. I said the doctors said that I would have to take it anywhere from 6 months to a year or for the rest of my life. I do not know my clotting factor. They did not test my blood for that yet. Taking the blood thinners right now, it wouldn't be an accurate test, so they have to wait until I'm done taking the Lovenox and completely off of blood thinners before they can check my blood for factor V clotting disorder, or clotting factor, whatever you want to call it. She said that as of right now, she is only going to have me on Lovenox for 4 months, and then she's going to do a repeat CAT scan, and if it comes back clear, then she's going to just take me completely off of Lovenox. I won't have to take it anymore after that. But she's going to also do blood work and check me for the check my clotting factor for factor V. And if I do have it, then she said, yes, I would have to remain on blood thinners for the rest of my life because I would be at a higher risk of getting another clot in my lung or anywhere. She doesn't think that I have a DVT in my legs or anything because I don't have any pain, redness, or swelling or anything in my legs. Okay, the next person is Jen H. Hi, Jen. You're wondering if this is pregnancy related. My doctor does think this is pregnancy related just because I don't show any signs of any DVTs in my leg or anything like that. She's thinking maybe it come from my pelvis area. I did have a pretty bad hematoma after I delivered Scarlett. It could be from that. I don't know. She does think it's pregnancy related though. So she told me that I would never be able to take birth control ever again. And if I ever got pregnant again, which I didn't plan to, I would have to be on blood thinners throughout my whole pregnancy. So there you go. A journey to becoming parents. Hi. You're wondering if there's any cheaper medication. There most likely is cheaper medication. The pharmacy said they're all pretty pricey, but the cheapest I think is Coumadin or warfarin. The reason why she didn't put me on that is because I am breastfeeding, and if I did have to go on that and didn't have no other choice but to go on that, I would have to stop breastfeeding. But we're trying to do everything we can right now to continue to live in Ox and find a way to pay for that so I can continue to breastfeed. I did send an application. Me and my doctor both filled it out through a Live in Ox program called it's called patient programming. It's supposed to help pay for the medication for up to 3 months free, or at least a discounted price to help with that. But I won't know anything until next week, and if they don't, then I will most likely have to go to the pill form and quit breastfeeding. Amy Willis, hi. You asked if I qualify for state aid. No, we don't qualify for state aid. At moments like this, kind of wish we did because it would help tremendously, but we don't. I think that's all the questions I was asked. If I'm skipping anybody, please leave a comment below. If you have any more questions, please leave a comment below, and I will answer them for you the best to my knowledge. But thank you guys for asking the questions, and I will talk to you guys later.